Hi everyone, welcome to your pre-op class. Today I'm going to walk through all of the information that you need to know about your diet, about your vitamins. We'll talk about exercise and a couple of other topics. We'll talk about everything that you need to know both pre-operatively and post-operatively to set you up for success for your bariatric surgery. I like to start with a review of our macronutrients. After surgery, we talk a lot about protein, but it's still important to have a baseline understanding of carbs, protein, and fat. So carbs are going to be the preferred source of energy for your body, meaning that this is what rapidly breaks down to give you quick energy. Protein is really important to help you build and sustain muscle mass, and we're going to talk about that in a few slides. Fat is important to help with your body with insulation. It helps regulate your hormones, things like that. We are going to still be able to eat these food groups after surgery. It might change the preference or the serving size. It might change the ratios compared to our other food groups. But I never want you to feel like you have to totally omit these things from your diet. Let's not forget that weight loss surgery is still a tool. Just like any other tool, you need to use it the way it's designed to get the better benefit out of it. I always like to make the joke that a lawnmower is a tool and so is a dishwasher, but you can't really interchange them for one another. So to get the most out of your weight loss surgery tool, definitely want to be adherent to behavior, lifestyle, dietary changes. You're going to want to be involved with regular exercise. Whatever that looks like for you is totally okay. Two really big ones I like to point out are getting involved with a support group and staying up to date with your care team. It's really helpful to talk to people who have been through the same experience as you to kind of get that perspective. You can rant, you can vent, you can ask for product recommendations, but then don't forget to follow up with us. We want to help you with any obstacles that you might experience, but we can only do that if you let us know that you're having them. So on that note, let's talk a little bit about how often you're going to come in and see us. You will come in for follow-ups at your 2-week appointment, 2-month appointment, 6 months, and 1 year. These are really just a baseline to make sure that you are not only healing okay, but that your diet is going well, that you're following it. If you have any questions, we can catch those before any mistakes are made, but also just to make sure that we can help you stay accountable to reach your goals. We always say that if you need to come in more often than that, you are more than welcome. If you feel like you're going to do better if you come in once a month, we'll see you once a month. You just let us know. Otherwise, this is kind of when you can expect to follow up. By no means am I a bariatric surgeon, so I'm not going to explain these in too much detail, but here are just a couple of different surgeries that you might be getting. So one is a sleeve, one is a bypass, which is a little bit more malabsorptive, and then duodenal switch and SATI are also malabsorptive surgeries. If you have questions about your specific surgery that you will be having, I encourage you to ask our surgical team for more information. One of the biggest nutrition considerations after surgery is staying hydrated, especially in those first few weeks. So your daily goal is going to be about 64 ounces or more per day. In the first 2 weeks, if you're only capable of getting about 48 to 50 ounces in, I don't want you to beat yourself up. We're not going to be upset with you. We realize it's hard. That being said, after that 2-week mark, really push to get those 64 ounces in. Your body is going to be excreting a lot of extra waste product because you're losing weight very rapidly. So you want to take care of those kidneys. If you can, you need to avoid any carbonation. You need to avoid any alcohol, any added sugars. And I would like you to avoid caffeine for the first month. Caffeine is a gastric irritant. It also dehydrates you. So for those reasons, we want to avoid it until you're a little bit more healed on the inside of your stomach. Carbonation can stretch your stomach out over time. Added sugars and alcohol are just not indicative for weight loss. Try to drink slowly, avoiding large gulps, big sips. If you have a sippy cup or anything that's not straw, I would recommend drinking out of those products. Awala and Munchkin 360 are two great products you could check out on Amazon, Target, Walmart, but they're kind of like a sippy cup where you just pour it into your mouth. They don't use straws. Also, try to stop drinking any fluids about 15 minutes before you have a solid food meal. And then after that solid food meal, wait about 30 minutes to have more fluids. Putting fluids and solid foods in the stomach at the same time can be a little bit uncomfortable after bariatric surgery, so that's the reason we ask you to space them out. So here are a couple of examples of beverages you can still have right after surgery. Obviously, plain water. If you're someone who doesn't tolerate plain water very well after surgery, you might want to switch to an alkaline water for a couple of weeks. Alkaline water has a higher pH, so it's lower acidity, and it can be tolerated easier on those of you who can't tolerate regular water. Any sugar-free beverage is fine, so Crystal Light, Powerade Zero, Gatorade, those little Mio droplets are totally okay. Just make sure that everything is sugar-free, not carbonated, and you're pretty much going to be good to go. You can also have sugar-free popsicles, but I don't want your 64 ounces a day to be mostly from popsicle water. So use those sparingly, but they're a great way to get some extra hydration in. Time to talk about protein. Your protein directly impacts your muscle mass. Now, something you might not know about muscle mass is that it's the most active tissue in your body. It's what burns the most calories. So when you're on a very low calorie diet, like you will be after surgery, your body is going to want to get rid of your muscle mass first because it's taking up all that energy. It's going to want to conserve that. So the way we can protect that from happening is by having a high protein diet. What does that look like? Well, it looks like having a high protein food at every meal and every snack. Your goal is going to be about 60 grams per day. I always want you to try to have that protein at the beginning of the meal so that you can maximize how much you're able to get to physically consume. Protein sources could be chicken, turkey, fish, meat. It could be Greek yogurt. It could be cottage cheese, anything like that. Generally, we want to choose lean protein sources so that we have a higher ratio of protein to fat in our diet. Again, 60 to 90 grams a day. I always recommend scheduling your meals, trying to avoid any boredom or mindless grazing. It is true that the first couple of weeks, couple of months, you might not necessarily feel hungry 3 times a day like you otherwise would. So with those exceptions, I don't want you to eat if you're not hungry. Purposeful meals after surgery look like eating to get our protein in or eating because we're hungry. I don't want you to ignore your hunger cues, but I also don't want you to overconsume and feel overly full and then feel pain. Allow for these meals to take about 15 to 30 minutes so you can chew to an applesauce consistency. That's going to help not only pace your meal, but help it digest more comfortably. You want to chew to kind of an applesauce consistency. In doing that will take between 15 and 30 minutes. After 30 minutes, end your meal just to prevent accidentally overeating. You might find that your body gives you some hunger cues or some fullness cues. A lot of patients say that their nose might start to run, their eyes water. That is just a signal that your body is telling you that you are approaching fullness. So here are a couple of different ways you can eat with a little bit more intention or mindful. Using smaller plates or utensils is a great way, especially if you have someone in your family or your friends who have little kids. You can just borrow a couple of their things or go to the dollar store. I recommend using measuring cups or a food scale to determine what a standard portion size looks like for you. This is going to take a lot of stress out of the meal. And then I always recommend also using your non-dominant hand or putting the fork, utensil, the food item down between bites, letting yourself chew, process that meal, and decide if you want to go in for another bite. Before we get into the nitty-gritty details of the post-op diet, in general, we're just going to be encouraging a low-fat, low-sugar diet that is rich in whole foods, nutrient-dense things. I kind of like to make the joke that I want you to choose mostly foods that used to swim, fly, walk, crawl, or grew out of the ground. So that means if what you're eating is mostly a whole food, it didn't take a lot of extra steps to get that, chances are you're good. Boxed mac and cheese, for example, takes a lot of steps to get things from the earth to create a boxed mac and cheese, but it doesn't take a lot of steps to get some roasted vegetables, a side of grains, and a protein, right? So that's kind of what we want most of our meals to look like, a whole food base. Even though you are going to follow a very balanced, whole food rich diet, you will still need to take bariatric vitamins and minerals after surgery, and we're going to talk about this at length here in a few slides. So after surgery, we advise you against smoking. We recommend completely omitting this from your lifestyle. Smoking after a bariatric surgery can increase your risk for an ulcer, and if you have any specific questions about your risk associated with these, please make sure that you ask our surgery team prior to surgery. We also recommend avoiding alcohol completely after surgery. Your body will metabolize it a lot differently, and this can increase your dependence on alcohol and decrease your tolerance. Over time, that exposure can result in something called addiction transfer, and we want you to be explicitly informed about this. So for that reason, I recommend no alcohol after surgery. No matter what surgery you have, whether it is a sleeve or a bypass, a SADI or a DS or a revision to either, you need to be taking bariatric vitamins. So the volume of food that you eat drastically reduces, and like I said, in some surgeries, your malabsorption is a little bit more prominent. So these vitamins are specifically curated for those of you having an altered anatomy to make sure that you maintain an appropriate nutrition status. You will start taking these 2 weeks after surgery. If it's easier for you to remember, you know that you're coming back to the office 2 weeks after for your first post-op check, so you'll start them that same week. You will need a chewable form for the first 3 months. This just ensures that you are actually absorbing those nutrients that you are in need of. Failure to taking these vitamins can increase your risk in some otherwise very preventable side effects. Some of these include nutritional anemias, low bone density, or Wernicke's encephalopathy. This is a B1 deficiency. It's pretty rare, but it's one that we definitely want to stay away from. So let's take our vitamins and totally not have to worry about deficiencies. Our office will ask you to purchase these for the first 3 months. You can do that on our Shopify through a subscription program. This is just to make sure that you have everything that you need to set you up for success after surgery. All right, so everyone should have a pre-op packet that includes this exact same chart. In this red box, I have highlighted the baseline nutrients that are required to take after surgery initially. So starting at the top, a bariatric adult multivitamin. You will take this daily. Depending on the brand, you might need to take 2 per day. You might take even 4 per day. I would say average is 2. Once you hit that 3-month mark and you want to switch to a capsule vitamin, you can do so. So that's the multivitamin. With iron, ASMBS guidelines, which is Association of Metabolic and Bariatric Surgery, require 18 milligrams of iron for those having a sleeve and for those who don't have a history of iron deficiency. If you have a history of iron deficiency, if you are having anything besides a sleeve, or you have a heavy menstrual cycle as a woman, you might need to be taking a higher dose, around 45, even 65 milligrams per day. Some multivitamins will contain up to 18 milligrams of iron in them, so that's something that we can always talk about one-on-one. Iron is very commonly adjusted after surgery, so this is one that I might say, hey, Joe Smith, we need to increase your iron. It's totally normal. Calcium citrate is the next one. So your body requires 12 to 1,500 milligrams of this per day, but you can only really absorb 500 to 600 milligrams at one time. So for that purpose, we space them out throughout the day. You might take 2 600 milligram supplements, or you might take 3 500 milligram supplements. Spacing those out consistently is really key to make sure that you absorb the calcium. If you do end up having a SADI or a DS, you will take 18 to 2,400 milligrams of this per day, just because of that higher degree of malabsorption from the surgery. Vitamin B1, this is that vitamin that can cause that Wernicke's that we really want to be mindful of. You need 12 milligrams of that per day. Just to be super protective, I encourage everyone to take that outside of a multivitamin. There is not really a toxicity associated with this. It is water soluble and your body will excrete what you do not need. However, we will always keep our eye on it on your labs that we will check at your 2-month, 6-month, and 1-year appointment. Similar to appointments, you can have your labs checked as often as you like. B12, zinc, and biotin are commonly provided in sufficient quantities in a multivitamin, and therefore labs look great on these 3 vitamins, or supplements rather. However, they are also common to need to supplement outside of a multivitamin. So and our office does not require you to start taking these outside of your multi until your labs show us that you might be trending a little bit downward. So if you want to get them, great, but our baseline requirement are going to be that multi, calcium, iron, and B1. Now I know that was a lot of information and you're probably wondering, how the heck am I supposed to take all these vitamins? Just remind yourself, the first 3 months are the most not fun because you have to take the chewables. After 3 months, it's going to be a lot easier. So if you take a thyroid medication, you would want to follow Schedule A that you can see in the blue. It's really important that you take those thyroid medications 4 hours before you take your calcium, because calcium and thyroid medications will interact and they will cause that thyroid medication to work less efficiently. Otherwise, you can follow Schedule B, Schedule C. You can make up your own schedule if you want. But this is kind of just to show you that your calcium should be spread out throughout the day. I recommend taking iron at bedtime just because that iron, it's a metal, it can sit a little heavy in the stomach and cause some nausea. Generally, you won't experience that if you've had food in your stomach and you're about to go to bed anyways. Most B vitamins you can just take whenever you feel like it. So if you want to take your extra B1 with your multi, that would be a great way to do it. 10 days before surgery, you're going to start the high protein full liquid diet. The purpose of this is to shrink your liver. Your liver sits right in front of your stomach, and it's a very vascular organ, and it has a lot of stored carb and stored fat around it, or it could. So when you go on this diet, it's very low calorie, it's very low carbohydrate. It's going to help just free up some of that stored carb and fat around the liver, making it a lot smaller, which improves the safety of your surgery and reduces the risks. So this is purely for your safety. I'm not going to say it's a fun part of the surgery phases, but it is a very important part. So it's high protein full liquid. So let's talk a little bit about the protein component of that first, and then we'll dive into the liquid part. So you're going to have 3 to 4 protein shakes a day. 3 to 4 meaning breakfast, lunch, dinner, and a snack. If you can get 2 in, 3 in, that's okay. When you're choosing those protein shakes, it's really important that they have at least 20 grams of protein and they're fewer than 200 calories. Otherwise, I'm not super strict on the 5 grams of sugar or fat, as long as sugar or fat is always a single digit. And 20 grams is always met and 200 calories is always met. When you're looking at the ingredients for the protein powders, whey protein isolate is one of the better forms for absorption, but if you decide that you want to totally omit dairy products, soy protein is a great option, or pea protein. When you're looking at the nutrition label for those protein supplements, check out the nutrition label. Look at the serving size. I can't speak. So those numbers that you see, the calories, the protein, things like that, those reflect one serving. So if you get a pre-made shake, like a Premier Protein, a Fairlife, that's going to be that full bottle. But if you get a powdered protein, sometimes 1 scoop is a serving and sometimes 2 scoops is a serving. So you got to make sure you check out that serving size so that you can properly count how much protein you actually are consuming in a day. So this is an example. It looks like a protein shake, but that doesn't mean it is one. This would not necessarily be appropriate, right? Because it's got nearly 30 grams of carbohydrates and only 10 grams of protein. That's not really the ratio we're looking for. We're looking for something more like a Premier Protein that has 30 grams of protein, hardly any sugars, no fat, or vice versa, and is only 160 calories. So this would be a great example of something that you could have after bariatric surgery. Sugar-free liquids. So while you're going to have all those protein shakes, you can also do sugar-free clear liquids. So water, but you can also do broth or bouillon, any sugar-free Jell-O, pudding, or popsicles. You can do decaf coffee or tea. You can do any non-carbonated sugar-free drink. So again, Crystal Light, Mio, Powerade Zero, things like that. Artificial sweeteners are pretty common in a lot of the above items. Sometimes people can tolerate stevia or monk fruit a little bit better than something like aspartame or sucralose. Whatever you prefer is fine. You can do skim milk and you can do 1%. If you drink almond milk, that is okay as long as it is unsweetened, but you cannot do oat milk because that is essentially just a pureed carbohydrate. And remember, we want to do a very low carb diet on these 10 days. You can also do Greek yogurt. Just make sure that it is sugar-free, low fat, and if there's any fruit purees on top, just go ahead and scrape that portion of it off. Just taking a little pause right here to say that if you do take any medications that impact your blood sugar or your blood pressure, it is always recommended to let our office know if we don't already, and to let that prescribing provider know so that all of your providers are aware that you are going on this diet and can direct you on those medications appropriately. After surgery, you are going to follow 6 weeks of a post-op diet. This will be broken down into 3 2-week sections. Again, I don't know that it's necessarily fun, but it is very important, and you can be mad at our office. We will take it in stride, but the purpose of this is just to make sure that you heal okay, that everything is not causing you any pain. You're not going to get an infection from any foods being caught on the inside. The stitches are going to heal appropriately, but definitely to make sure that you are nourished and giving your body all of those nutrients it needs to heal, because at the end of the day, after any surgery, you have a wound, and that wound needs to heal. So again, everything is going to be in 2-week stages. So the first 2 weeks is the exact same high protein, full liquid diet that you follow 10 days before surgery. Not one thing changes here. So again, thin broth, water with bouillon, any sugar-free Jell-O, pudding, or popsicles, any decaf coffee and tea is fine, any sugar-free clear liquid drinks that are not carbonated. Still, you can do those skim milk or 1% milk. I will say lactose intolerance is relatively common after bariatric surgery, so I generally will say wait to have a cup of milk for 2 to 3 days just to make sure you have a little bit of time at least without any of those side effects. When we think about soup, we are thinking about broth. We're not doing creamy, cheesy potato soup. Those are not low fat or low carb, really. So we need to make sure that we are giving ourselves protein and hydration. If you're going to have a soup and you want it to be creamy, you can get Campbell's, for example, has a 98% fat-free cream of chicken, cream of onion. Think the cans of stuff you would add in a crock pot. You wouldn't necessarily open it and eat it by itself. It's a base, right? You can get those, add an unflavored protein powder, and eat it then. But you have to add protein to it. With only being 2 weeks out, or at most 2 weeks out, everything you put in your body, if it's not hydrating you, it needs to be fulfilling that protein goal. So there's just not any room in the diet to have other items. We're specifically avoiding anything with added sugars, any caffeine, any carbonated beverages, any whole fat dairy products, any solid foods, any fruits or vegetables. This includes mashed potatoes, grits, oatmeal, baby food, smoothies. Sorry, I had kind of a pause moment there for a second. We're also avoiding any blended foods. So like I said, no fruit smoothies that you blend up. I totally understand that the texture is right, but again, everything has to be rich in protein or a hydrating liquid. There's just not room for those types of other items right now. We're still avoiding any orange juice, grapefruit juice, and then no meat, no beans, and no starches. Those are not appropriate for what we refer to as chemical digestion, just as much as mechanical digestion. This is a very broad example of how you can space out those fluids and meals throughout the day, but the very last page in your pre-op packet is a much more thorough version of this created by our nurse, and it is an exceptional resource to use. So it kind of will break it down every half hour how you can consume your fluids, consume your protein. There's no expectation from us that you're going to follow that exactly. It's just there for a reference if you'd like it. Okay, so now we are on the pureed phase. So it's been 2 weeks. You're going to come in for your first post-op appointment. This is also when you're going to start taking your chewable vitamins, because remember, we take those chewable ones for the first 3 months. But at this point, you can add cottage cheese and you can add scrambled eggs. You can have poached eggs or over easy eggs. I would not recommend hard-boiled at this point just because they're a little bit more dry. You do not need to blend or puree the cottage cheese or the eggs. They are soft enough to go down. What I do want you to blend would be any canned meat like chicken, tuna, or salmon, or any canned beans. You're looking to get kind of a baby food texture or a refried bean texture. The beans need to be low fat and the meats need to be canned. That canned meat is going to be a lot more moist and it's significantly easier for your body to break down. If you try to poach your own chicken and then puree it yourself compared to the canned meats, you will notice the canned meat is much easier to digest. We're specifically still avoiding any solid foods, crunchy foods, rices, pastas, popcorns, still no fruits or vegetables, any whole cuts of meat. If it is not on the list on the left or a full liquid, we are not having it. Your body is very sensitive still at this point. You're still very, very fragile, and it is very crucial to follow this diet. I don't know how many times I just said the word very, and I apologize, but I can't explain enough how important it is for your safety to follow this diet. For stage 3, you can add a lot of different things in at this point. So this is soft food. You can add lean ground meat. I would probably put a broth or a gravy over it to help moisten it and digest more comfortably. You can also use moist cooking methods to shred meat. So if you cook chicken in a crock pot, finely shred it with some of that broth you cooked it in on top, 2 thumbs up. You could bake some fish and it's flaky enough and soft enough that you can digest it well. Tofu's all right, deli meat's okay, just make sure you get it sandwich cut or thinner. And then any of those canned meats or fish or beans you can still have, but you no longer have to puree them. Still avoiding a lot of those same foods. So any whole fat dairy products, anything crunchy, anything solid, any whole cuts of meat, so like an actual piece of chicken breast. You still need to, break it down. And then no spicy foods, so no cayenne pepper, hot sauce, red pepper flakes. You're more than welcome to season and flavor your meals, but nothing spicy. But you could do Italian seasoning, garlic powder, oregano, things like that. At this point, and this point only, you can start to add fruits and vegetables, but the rule is that all of the vegetables have to be soft cooked, and then we're going to avoid any fruits that have little seeds in them. So namely strawberries, raspberries, blackberries. The other rule is that you have to eat protein first before you eat your fruit or vegetables. So if at lunch you have your deli meat slices, then you could have some blueberries. Or at dinner, if you have your baked and flaked fish, you could have some sauteed mushrooms or zucchini afterwards, but they have to be soft cooked and they cannot contain any seeds. Stage 4, you're all the way done with your bariatric post-op diet. Now you're kind of just on a regular maintenance diet. You can kind of start to add foods in as you feel comfortable, but I will say be cautious of true carbohydrate-based foods like pastas, rices, or breads. I would wait to have those for about 6 months, as well as any whole grain. So steel-cut oats, brown rice, barley, quinoa. It's very common that it's going to take 6 months for you to comfortably tolerate those. Same thing goes with raw vegetables. Those are great sources of carbohydrates, the ones that we just listed as our vegetables, but because of that fiber, it's very common for it to be a little bit longer until you can digest those. Tough cuts of meat, specifically steak and pork, so a ribeye, a pork chop, those have a protein in them called gristle, and it's just a little bit of a harder fiber, like muscle fiber, to break down. So it's pretty common for those to take a little bit longer to tolerate, but it's not going to be a forever thing. Continue to avoid anything packed in syrup, like I said, raw or tough vegetables, fried foods, or concentrated sugars, as you will still be sensitive to these things. So use your best judgment when you're starting to have a food for the first time. Treat yourself like you're a little baby. I mean, when we start giving our little ones real foods, we go one at a time to make sure they're not allergic. You kind of want to treat yourself like that to make sure that you can tolerate things. There's nothing wrong with going slow if it means that you're going to feel better and feel well after you have a meal. So this slide is really just meant to be an overview of what I want you to remember for your diet. So again, high protein first and foremost. Increase produce because we want to increase those whole foods, nutrient-rich meals, and then lower carb, lower fat. If you picture a pie chart with 3 sections, carb, fat, and protein, and then protein becomes half that pie chart, carb and fat naturally decrease. And it's not because they're bad for you, but because protein becomes more important. When you can choose carbs and you can tolerate fiber, fruits, vegetables, whole grains, those are the kind of carbs I want you to choose. It doesn't mean there's never room for those sweet treats and things like that, but 90-95% of the time, I do want you to choose those more nutrient-rich foods. Portion sizes are going to look different. So if you and your friend have surgery the same day, you're not necessarily going to tolerate the same volume of food in 3 months. That's fine. It's an individual journey. You are on your own race. There's no one else in that race. You're the only one. Everyone else is in their own race. You don't have to compare yourself. Also, again, use measuring cups, use food scales. If you know you can comfortably tolerate 2.5 ounces of chicken, you can take that scoop that you use to get that chicken out and take it to your friend's house and know you can tolerate that much at her house, and kind of just takes the stress out of the meal if you know what you can anticipate for and you know what you can comfortably have. So this is what we call the bariatric plate. This is what I want all of your meals to look like after surgery. Protein being the most prevalent component of your meal, and you're going to want to eat that first. The second thing, or the next thing you eat, is going to be your non-starchy vegetable. This could also be a fruit. So, and the last thing that you eat should be that true carbohydrate source. This does a couple of things. One, eating mostly protein and fiber at the beginning of your meal is going to fill you up quicker, so you prevent overeating. And two, when you do consume those carbohydrate sources, that protein and fiber at the beginning of the meal is going to help that blood sugar trend a little bit lower, or in other words, just not spike as much. So if it's lunchtime and we have some grilled chicken, some broccoli, and then maybe an apple, I would want you to eat, or instead of an apple, we have like some rice or something. Eat your protein first, then eat your vegetable, whether it's broccoli or asparagus, whatever, and then eat your true carbohydrate food. So whether that's rice, pasta, a side of mac and cheese, things like that. Eat that protein, eat that vegetable first, and then if you have room, you can consume that most carb source. So this is a sample day of eating after surgery, just to highlight that you can still have regular tasty meals. And you'll notice that the protein is the first item at all of these meals. So this is how you would structure your meal when you eat it. You'd have your eggs first, then your fruit. Your chicken breast first, then your cucumbers, then your strawberries, because of that fiber carbohydrate difference. You would have your cheese stick before you had your bell peppers. You would have your cod before you have your veggies, things like that. It's really important to us and everyone at this office that you still enjoy food after surgery. Just because you are having weight loss surgery does not mean that you do not get to enjoy birthday parties, holiday events, cultural celebrations. You are still a human and you have that right. That being said, we just want you to make choices that are going to align with your body and align with your goals and not make you feel sick. Try not to get stuck using safe foods for long term. You shouldn't have to rely on Greek yogurt and cottage cheese for breakfast, lunch, and dinner, right? When you're having snacks, those meals count too, right? So a lot of the time I think people will have 3 really balanced meals, breakfast, lunch, dinner, but then snacks in the afternoon or the evening is kind of where they go haywire. Those count too. So try to make sure those are balanced as well. If you're having pretzel chips or protein chips, you've got protein, but you're missing some type of fresh whole food. So maybe you add some berries on the side. When you're going to have salads or you want to dip your chicken into a sauce, opt for something that is going to agree with your body a little bit better. So this could be a sugar-free barbecue or sugar-free teriyaki sauce. It could be a Greek yogurt-based ranch dressing. Little swaps like that go a long way in regards to tolerance and total protein, total carb intake. So someone from our surgery team will go over these post-op side effects, or potential side effects rather, with you at your consent appointment. Dumping syndrome is more common with those having a bypass than it is anyone having a sleeve. Essentially, what happens is a concentration in your intestine. So I want you on a picture, you have a little shot glass of water, and you accidentally pour a full Crystal Light packet in that shot glass. That would be very, very concentrated and sweet lemonade. So you would probably pour that pitcher or that little shot glass with the concentrated lemonade into a big glass of water to dilute it. In this example, that shot glass is your intestine when you have a high fat or high starch meal. It's very concentrated and your body doesn't like it. So to dilute that naturally, your body is going to pull a lot of water into your intestine. Your intestine goes from that small shot glass size to that large glass of water size. And when it pulled all that water, it took electrolytes, it took protein, it took blood sugar. Then you're going to have a loose bowel movement and get rid of all that water. Now you're left with low blood sugar, low electrolytes. You don't feel good. You might be dizzy, you might be nauseous, you might be sweating. The best thing to do in this situation is to replete those electrolytes, get some protein in your blood, in your body to stabilize that blood sugar, and call us if you need help, right? Get some food in you and stabilize that blood sugar. This can be totally avoided by omitting high-fat, high-sugar meals from your diet. And again, this is more likely to happen in a bypass than a sleeve, and you are absolutely welcome to call us anytime if you feel like this is happening and you need some help to get through this. So last couple of slides here, you will probably wake up with a bad taste in your mouth. That's just from anesthesia, not tasting the best. You will wake up with gas in your chest, your shoulder, or your back. Walking is the best way to get that out. And then fertility will increase in women after surgery who are childbearing age. So we recommend waiting 18 months to conceive. And then you will get medication for pain, nausea, and acid reflux. And someone from our surgery team, most likely Molly, will review that information with you. She will also review your NSAIDs. Here are your NSAIDs. It wouldn't let me click to the next page. So, physical activity. Physical activity is just as important as your diet after surgery. You can follow that diet to a T, but if you are not moving your body and helping to protect your muscle mass in that way, it's not going to work. So our goal for you is about 150 minutes a week with 10,000 steps a day. So this could be 5 times a week for 30 minutes, going on a walk. It could be lifting weights. It can look like anything you want. The goal with activity is just to move your body outside of what your daily life requires of you. If your daily life requires you to walk your dogs or run around and chase your kids, you have to do that. So what you want to do for exercise is something that looks completely different. If you're a nurse or you're a teacher and you're on your feet all day, maybe walking on the treadmill isn't even going to be as enjoyable for you because it's not going to get your heart rate up as much. So maybe for cardio, you would prefer to go on a bike. Maybe you'd prefer to do some weights. If you work in construction and you're lifting weights all day, working in that construction area, you might prefer something a little bit more low impact. You might prefer doing some type of yoga or Pilates. But at the end of the day, anything that gets you moving and that you find fun works for us. Thank you so much for spending time with me and learning a little bit more about all of your diet and vitamins and lifestyle habits to change after surgery. I hope that you found this useful and that this helps you feel a little bit more confident going into the OR. If you have any questions at all, please reach out to the office and contact us anytime that you have questions throughout your experience, and I wish you all the luck.